At the heart of welfare is the notion that government is responsible for the prosperity and success of our lives. It's not. Government is responsible for providing environment and helping people when needed with a hand up, and not a handout. In today's economy, there is a need to ensure that everyone is pulling their fair share in earning a living. In 1996, congressional Republicans and President Bill Clinton enacted reforms that required beneficiaries of a new welfare program temporary assistance for needy families to either work or prepare for a job. President Clinton triumphantly declared these reforms would end welfare as we know it, and in fact millions of families have since moved off the TANF rolls and begun to provide for themselves. There are two areas that I believe that must remain in place for a person to receive welfare benefits. A person must work and submit to drug testing. The Welfare Reform Act represents the federal government's attempt to reform the welfare system by encouraging recipients to leave welfare and go to work. The H.R. 1167 Welfare Reform Act of 2011 builds on the reform of 1996 by requiring food stamp recipients to either work or prepare for a job, helping them to become independent of government assistance. Under the Welfare Reform Act of 1996, the following rules applied. Most recipients are required to find work within 2 years of the first welfare payment. In 1996, welfare legislation gave states enormous flexibility in fulfilling its requirements, and many interpreted the law liberally. Some counted work as the hours that the recipients spent traveling to and from alcohol and drug abuse treatments, or helping others with a friend's task at home. Certain states allowed home exercise, motivational reading, and anti-smoking classes to qualify recipients for aid, reasoning that such practices could lead to work. The federal government also tightened the definition of what counts in fulfilling the work requirements. No longer would spending time in psychological counseling or traveling to jobs training do the trick. The feds urged the states to enroll more welfare recipients with psychological and mental disabilities into job training and job replacement programs. Individuals who have disabilities should be afforded the same opportunities, engage in work and find work-related training, work experience, and employment as those who do not. Most recipients are allowed to receive welfare payments for a total of no more than 5 years. The states are allowed to establish family caps that prevent mothers of babies born while mother is already receiving welfare to receiving more additional benefits. The number of the benefits are determined by the number of by different eligibility requirements. How many are in the household? Anyone pregnant? If there's a migrant or seasonal workers, if the utility bills and the necessary living requirements. There's also the whole gross income for each family member, actual available cash on hand. If a person is capable of working and can be utilized to earn these benefits, I believe that they should also be subject to random drug testing. Under the 1996 law, able-bodied adults have been required to work, seek employment, take classes, or undergo drug and alcohol counseling in exchange for taxpayer funding. Drug testing would be modeled after the tests required by mandatory guidelines for federal workplaces. And if an applicant tests negative, they would be eligible for reimbursement. Anyone that fails the first time would not receive their benefits for 1 month. A second time positive would receive 3 months ineligibility, and a third time would ban them for a year. They'd have to retest again to be able to get their benefits back, and the states would not be able to pay, or would not have to pay for their substance abuse testing or treatments. With these two areas established, we now need to maintain the Welfare Reform Act of 1996 and not allow it to be changed by the gutting of the welfare reform that is being quietly pushed through for 2012. In 2012, the Department of Health and Human Services quietly notified states that they may seek a waiver for the program's strict work requirements. According to Mitt Romney, President Obama now wants to strip the established work requirements from welfare. The new policy directive said states may seek a waiver from the work component of temporary assistance for needy program in order to test alternative and innovative strategies, policies, and procedures that are designed to improve employment outcomes for needy families. It is suddenly allowing more flexibility in a program known and in many circles lauded for its rigid framework. Currently, states have to have 50% of their caseloads meet certain work requirements, though there are always a way to get around that. States will be held accountable for their alternative act plans. By waiving the law requirements, President Obama will make it harder for Americans to escape poverty. We need to continue to make individuals work to seek employment and to work for their money and then submit to drug testing. When the hard-fought welfare reform program was established in 1996, it was part of a welfare reform of 1990. It was intended to give the states flexibility to design effective programs to help parents move away from welfare to work. Today, however, federal rules dictate mind-numbing details about how to run welfare work programs. Most states and experts agree that these are not helpful. A closing thought from former President Reagan: we should measure welfare success by how many people leave welfare, not by how many are added. Will you fight with me to keep the reform of 1996 alive? Thank you.